My name is Sanna Rimpiläinen, Head of Research and Skills at the Digital Health and Care Innovation Center. I have to tell first off, come clean, I have no background in decontamination or sterilization. I had barely ever even thought about this topic until I was asked to come and talk here, so it's going to be something completely different for you this morning. And I have to just say that having heard John's and Helen's presentations, I have high respect and appreciation for the work that you do. And if I ever end up in hospital under any kind of surgical procedure, I will be thinking about all of this that I've been hearing here today. I will tell you a little bit about the Digital Health and Care Innovation Center first before I get into my real topic. I'm trying to decide whether I can see the speaker queue or look at so that you can hear what I'm saying. Right, so I work for the Scotland's National Innovation Centre for Digital Health and Care, DHI for short. We were established in 2013. I've been with the DHI for 11 years, since 2011. I lead an internal research and knowledge management team and oversee our future workforce and skills development agendas. DHI is a world-leading collaboration between University of Strathclyde in Glasgow and Glasgow School of Arts. And as John was talking about the decontamination room setup, etc., it really struck me, have you thought about co-design with the staff and providers for how these workflows might work better? We're funded by the Scottish Funding Council and Scottish Government, and our sole purpose is to support digital transformation of health and social care services in Scotland. Before going forward, digital health and care, there's no universally agreed upon definition for what this actually means. So we've decided to follow the World Health Organization's definitions, and we'll talk about fields of knowledge and practice associated with the development and use of digital technologies to improve both individual and population health and well-being, and to improve health and social care delivery. And here on the right-hand side, you can see a selection of different digital solutions associated with digital health and care. And while my talk will be quite on a sort of general level, there will be things that could be applicable and will be applicable in your context, and maybe you can keep that in mind when I do this talk. And as I said, I am kind of totally on a creek without a paddle in terms of the decontamination side of things. So DHI pioneers digital transformation in health and social care, and we work, for example, with industry, like all the providers of technologies, to create digitally enabled person-centered solutions. And we also help them reimagine new ways in which these businesses could make business models to take them to the market. We also work with the NHS and social care providers to help them transform and to develop new evidence-based service models to enable partners to become ready for the adoption of these different digital solutions. We work with current and future workforce and service users to help them to operate confidently in this digital environment, as well as citizens, so that they can also derive benefit from from the new and emerging technologies. So all of the projects, I think there has been 270 so far within the DHI. We bring together industry, health and social care providers, academia, wider public sector services, and citizens through co-design, as I mentioned earlier. And we have also a fairly extensive international reach. And our portfolio shortly, these are the sort of key areas identified with the NHS and Scottish Government for areas that we will work in. So, moving forward on to looking at the impact of digital transformation, health and social care services on sort of high level. So, back in 2018, the Scottish Government commissioned us to look at emerging trends in health and care, in digital health and care, and this was our most downloaded publication. And then 2020, you all remember what happened, COVID hit, and DHI was part of Scotland's sort of front row COVID response unit. And we had the sort of primacy to observe how digital was taking over or transforming the health and social care delivery before our eyes. And we decided to do an update of this review, and if you're interested, there's a QR code for the report on the slide. It'll come again if later on. So this slide here shows the digitalization journey of health and social care sector, and it starts around 2005 with the increased use of cloud computing across health and social care services. Mostly, or primarily, it has been used in electronic health and medical care records, but it has also increasingly allowed other kind of digital innovations to take place. So cloud computing, electronic health records, that generates a lot of data, big data. The more and more digital devices are being used, more and more data is being generated, and that is the bedrock for big data, and big data is the bedrock for AI and other digital solutions to take place. Around 2016 onwards, between 2016 and 20, we saw rapid technology development generally in the UK, and there were various government-led initiatives to try and digitalize healthcare services and hospitals. There was, for example, different kinds of telehealth and machine learning processes, and these have enabled the emergence and integration of 5G technologies in 2018. Onwards, and until COVID, digital transformation in health and care in Britain was fairly slow. It was steady but quite slow. And before we move to looking at the COVID impact, I just want to point to, this is an old number, 2025 was meant to be the analog switch off taking place in UK. It's been moved to 2027. Because there are various connectivity issues, for example, in Highlands and Islands in Scotland, where analog phone lines are essential for people's health and safety. So once this switch off takes place, it has a huge impact on telehealth and telecare services. So COVID, as we all remember, was quite a shock, and before the pandemic there was like low to moderate acceptance of digital devices in health and social care and medical settings. But in the early days of the pandemic we saw a whopping 80-fold increase in the use of digital devices in health and care. And even if this kind of peak has come down, what this legacy has left us with is now that digital is an expectation rather than an exception like it was before the pandemic. The second thing that we like to point to, and if this was a couple of weeks later, I could tell you, I could have an updated slide to say that the expected market growth is actually $940 billion. We have a new report that's being published in May where this figure is going to come out, but it means basically this is one of the fastest growing economic sectors in the world. And there are areas here that will be also applicable in your context. And as I say, the market can be said to be buoyant, with the exception of digital health system, which is already a fairly some mature market, so it won't grow as fast as the rest of the areas. So getting back to this report, so we observed this kind of sea change taking place, and we wanted to understand what was causing it, or what were the areas that were kind of impacting this. And we looked at different technical and software developments taking place in health and social care. And the first one of these is the transformation of health and care services, areas of health and care delivery that will fundamentally change as a result of digital delivery. And as I mentioned earlier, there's the increasing use of cloud computing, the emergence of big data, predictive analytics, artificial intelligence, and all the other areas which are kind of based on this. So we're starting to see virtual and augmented reality. I don't know whether that would be useful or applicable in your training contexts, maybe. There's digital pharmaceuticals, pharmacy, digital mental health, and genomics. And AI is going to be big in healthcare. I think there's this thing saying that it has the biggest impact specifically in health and social care services in the next 20 years, and that we're going to expect to see something like 1.3 million job roles generated by AI in going forward. The second theme under technical development was the migration from analog and legacy systems to modern digital approaches. So I mentioned the hard deadline that was moved by 2 years, the switch of the analog phone lines. But this means that there's going to be a shift in traditional methods of delivery of health and care, digital and remote delivery, and care moving into community settings as well. The third theme is the acceleration of digital innovation in health and care. And in health and care delivery, we are seeing remote patient monitoring and care, mobile health devices, wearable technologies, Internet of Medical Things, and maybe Internet of Things is something that might be applicable in decontamination, maybe wearable devices or tracking systems, etc. And finally, acceptance of digital in health and care is one of the softer developments. So this is around building trust in digital in the health and care context and in medical context, and cybersecurity comes into play in this. There's also acceptance of digital as part of health and social care delivery and equity in accessing these services. And all of these changes obviously have a massive impact on workforce and their skills requirements and capability needs. So the emerging trends, the impact of accelerated digital transformation of health and care, these are obviously in health and care delivery, but as I said, there are things that will be applicable in your context as well. So we're seeing greater personalization of health and care delivery. There's more efficient, effective and precise use of health care data, growing health data autonomy for citizens, overall emphasis on well-being and prevention of ill health, care moving away from hospitals into community settings, and complete transformation in skills needs and workforce requirements in health and care. When we look at digital skills and digital capabilities for the workforce, it's really important to understand what we're actually talking about. And when we started looking into digital skills for the health and social care and the medical workforce, it was just banded as the one thing without really considering what it means and who does it apply to. And we've done some more research around digital frameworks for health and care. So when we talk about digital literacy, it can mean either sort of foundational ability, which is a prerequisite to developing digital skills. So it could mean that I can identify where an email program is on my computer, or it could be an umbrella term to denote the wider ability to do your work in a digitally enabled context. Digital skill is then an ability to, for example, send an email. Digital competency is a professional related capability or a skill. So the ability to perform a given digital task to an agreed job specific standard, and it could mean that I am able to send an email that meets the organizational standards for my job role. And digital capability is a future-oriented, higher-level concept, the ability to use transferable skills to learn to perform a future yet-to-be-defined digital task, so I can communicate with my patients or my colleagues using digital means. So that may be a bit of an overkill, but I think I like definitions, and I think it's really useful in taking this discussion forward otherwise. It's also important to understand whose skills are we talking about when we talk about digital transformation. And at the DHI, we have divided the workforce into these 3 broad categories of staff. So the first one is the frontline health and social care professionals, and this encompasses anybody from doctors and nurses to support staff, admin staff, porters, technicians, etc. Anybody who has any kind of role in the delivery of frontline care. Nature of work is changing most radically for these staff who need to adopt new ways of working and learn entirely new ways of doing things, skill sets that have not been previously been required of them. And this is where we talk about digital skills. The second category here on the right are the technical professionals whose job is to design, develop, deliver, and implement digital solutions for use by healthcare frontline services. And here we talk about skills like software development, computing, cybersecurity, project management, change management, etc. And the category here in the middle, the third category, is the newest and fast expanding and growing in importance. And I would imagine this is the kind of category of staff that will also start emerging as part of the decontamination and sterilization services with digital transformation, because you need the people who are able to deal with the data, who need to be able to curate and capture, organize, analyze, and process this information that the digital devices are generating, so that you can improve your services and do projections of where things could be improved, etc. And there's a piece of research by Health Education England who has suggested that there's going to be a massive increase in need for this category of professionals going forward. This is a different way of looking at the same picture. Basically, this is like the higher up you are in the pyramid, it's in terms of the proficiency of the type of skills that is required of these staff. So the higher up you are in the pyramid, the more kind of broader your digital and data capability proficiency is expected to be. I would say that the kind of decontamination staff will probably sit between the two bottom layers, but you will also need people who are going to be developing these solutions as well as dealing with the data. So this is a bit of a guesswork on my part. So what would digital transformation mean for your sector? And this is what I found on the internet. So there could be digital traceability systems, machine-generated data provided from washers and sterilizers. There could be automation and robotics in loading and unloading. There could be predictive maintenance using cycle data. Digital documentation is very easily done in terms of replacing paper pathways. And this means not just digitizing a PDF and uploading that, but having an actual database where you either enter the data or where the data is entered automatically through these devices and sensors and monitors that might be put into place. And this also means that there will be emerging data roles in data handling, quality assurance, and systems oversight. And what kind of skills might this require for you? So understanding tracking systems, interpreting machine cycle data, spotting anomalies in digital dashboards, using mobile devices for workflow prompts, documenting compliance digitally, and cyber security awareness. And finally, what kind of specialist roles might emerge? Digital decontamination technician, data or quality assurance specialist for sterile services, automation or robotics technicians, system super user roles. So before I finish, these are kind of like my final slides. There's a lot about digital capabilities and digital and data capabilities. And it seems that Britain is the queen of reinventing the wheel in terms of digital capability frameworks. We did a bit of research looking at these globally, and Britain was the top country in reinventing this for every service and every health board and every professional group. And my recommendation was, please do not reinvent any other frameworks, but then the Scottish Government commissioned the NHS to do this framework based on my report, but so this is now up and running. This is digital and data capabilities framework aimed at all health and social care professionals. Admittedly, it is sitting in Scotland, but I can't see that the roles could be very different across the country. NHS England is developing their own as we speak, but it is a very good place to start to examine what the digital and data capabilities might be. And there is also a self-assessment tool that is associated with this framework, which is completely confidential. It only takes your data, and then it sends you an email with your kind of links, with your level of proficiency, and points you to learning resources if you're interested in finding out where you're at and how you could improve. And right, so this is the final slide, and thank you very much for your time.